Hey everyone, and welcome. Today, we're diving into a really strange medical mystery. We're talking about a condition where the body's own security system, the one that's supposed to protect you, gets, well, confused and starts attacking itself. So let's investigate the very curious case of Guillain-Barré syndrome.
I want you to picture this. Your body has its own internal police force, right? It's fighting off germs and viruses every single day. But what if one day that police force made a huge mistake and arrested the wrong guy? And what if that totally innocent bystander was your own nervous system? In a nutshell, that's exactly what happens in GBS.
So let's start our investigation. How in the world does this internal mix-up actually happen? This first part is all about what we're calling the body's betrayal. Okay, so let's get the official definition out of the way. In medical terms, it's called an acute immune-mediated polyneuropathy. Sounds complicated, right? But what it really means is, it's a case of friendly fire. Your immune system, which should be going after bad guys like bacteria, accidentally turns on you and attacks your own nerves instead.
To really get this, think about your nerves like they're electrical wires. You know, how they have that plastic coating around them? That coating is called myelin, and it helps the electrical signals travel super fast. In GBS, your confused immune system starts to strip away that protective coating. Now, what happens to an uncoated wire? You get a short circuit, right? That's pretty much what happens to your nerve signals. They just can't get through properly.
So this internal attack is happening, but what does that actually feel like? What's the result of this short-circuiting? Let's find out in our next section, where we ask, what kind of weakness is this?
And here we have the most classic symptom of GBS. The weakness is really unique. It has a signature pattern. It starts from the ground and moves up. So you might first feel some tingling and weakness in your feet and legs. Then, that feeling literally travels upwards into your arms, your torso, and in the most severe cases, it can even affect the muscles in your face and the ones you use to breathe. It's like your body is losing power from the floor up.
But you know, it's not just about weakness. Patients often feel that pins and needles sensation. And if a doctor tries to check for a knee-jerk reflex, with the little hammer, a lot of the time there's just nothing. And because these nerves also control all the automatic stuff our bodies do, things like your blood pressure and heart rate can get really unstable and unpredictable.
So this leads us to the biggest question of all. Why? Why does the body's immune system make such a critical mistake? It's time to put on our detective hats for this next section. Who's the real culprit?
The biggest clue usually isn't found in the present, but in the patient's recent past. In most cases, about 1 to 3 weeks before the GBS symptoms even start, the person had some kind of infection. It could have been a stomach flu, maybe just a bad cold. This illness that came before, well, that's our prime piece of evidence.
And this right here explains the why. The scientific term for it is molecular mimicry, but honestly, let's just call it the mistaken identity theory. It's much easier to understand. So your body creates its police force, these things called antibodies, to fight off the infection, or bad guy. But here's the problem. Parts of your own nerve cells, the innocent bystander, look incredibly similar to the bad guy. So the police get confused. And in their big rush to catch the thief, they end up arresting an innocent nerve cell by mistake. It's a classic case of mistaken identity. So, who are these bad guys that look so much like our nerves? Well, the most common culprit, our most wanted suspect, is a stomach bug called Campylobacter jejuni. But other viruses can do it too, like the flu virus or Epstein-Barr. And in very, very rare cases, a recent surgery or even a vaccination can act as the trigger for this whole confused response.
All right, so we've got our suspects lined up. But how do doctors actually confirm that GBS is the problem? Let's look at the real detective work that goes on in our next section, the diagnosis.
Clue number 1 is a spinal tap. Now, that sounds intense, but it gives us a huge piece of evidence. Doctors test a tiny bit of the fluid that surrounds the spine and brain. And in GBS, there's a classic telltale finding. The amount of protein in that fluid is super high, but the number of infection-fighting white blood cells is totally normal. That combination is a massive pointer that says, hey, look over here, it's GBS.
For clue number 2, we're going right back to our electrical wire analogy. A nerve conduction study is a test that basically checks the speed of the electrical signals running through your nerves. And just like we talked about, if the wire's coating is damaged, that signal's going to slow way down or maybe even get blocked completely. That is exactly what this test shows in a person with GBS.
And finally, clue number 3 can sometimes come from an MRI scan. Here's what they do. They inject a special dye. And if the nerve roots, that's where the nerves actually exit the spinal cord, if they look brighter than normal on the scan, it's a big sign of inflammation. The nerves literally light up, showing the doctors exactly where the attack is happening.
So, the case is solved, the diagnosis of GBS is confirmed. What now? Is there a treatment? Let's move on to the most hopeful part of this whole story, the comeback.
Yes, absolutely, there is a treatment. The main goal is to get that confused immune system to just calm down. One way is called IVG, where they basically flood the body with healthy, normal antibodies to distract the bad ones. Another way is plasmapheresis, which is like a blood cleaning process that literally filters out all those bad antibodies causing the trouble. Of course, alongside that, close monitoring of breathing and heart function is critical, followed by a whole lot of physical therapy to get that strength back. Now here is a really important point. You might think, oh, it's an autoimmune thing, so just give them steroids, right? And for a lot of autoimmune diseases, that's true. But GBS is different. Study after study has shown that corticosteroids are just not effective here, and that's a critical piece of information for the treatment plan.
So after all of this, what's the final outcome? How does this fight usually end? Well, as you can see, it is overwhelmingly good news. About 70% of people make a full recovery. Now, it can be a really long and tough road, but recovery does happen. While a small number of people might have some permanent disability, the vast majority win this battle against their own body.
And that wraps up the very curious case of Guillain-Barré syndrome. It's a story of mistaken identity, some amazing medical detective work, and for most people, an inspiring comeback. It just goes to show you, our body's inner world can be full of some serious drama. So let us know in the comments, what medical mystery should we try to solve next? Thanks so much for watching.